Greetings to all, and welcome to our podcast series. We have our regulars today, Dr. Vincent Taffuri, and today we are featuring Dr. Peter DeNoble. Welcome, Dr. DeNoble.
Thank you.
Welcome. There he is. Good morning.
Hey, good morning.
I just finished my CrossFit class. That's why I'm here at the gym, trying to get everything in at one time. You know what that's like, Dr. D, right?
Yeah, of course. I wish I could make it to CrossFit. That's all.
What's that?
I wish I could make it to CrossFit.
Yeah, well, it's been 3 months. I love it. It's pretty good. Pretty good. All right.
So, this podcast series generally focuses on health, wellness. We bring in various people from, have experience both with traditional medicine potentially as well as holistic care. So that being said, if you can give us, I guess, a primer on your background, what led you into the field of orthopedics, and what you're up to, basically.
Sure. Thank you for having me again. I'm an upper extremity orthopedic specialist. So what I do is I do shoulder. I take care of problems of the shoulder, elbow, wrist, and hand primarily. I also take some general call and stuff at some of the local hospitals. But for the most part, I really enjoy what I do. It's really gratifying to be able to, identify problems in these, these musculoskeletal problems that I can then fix, essentially, whether it be, just through simple things like therapy and other types of modalities, injections at times, all the way up to surgical options that work really well as well. So it's really, I find it really gratifying to be able to identify problems, help people get back to doing what they want to do, be it CrossFit or going back to the gym, or just enjoying, gardening and doing other, hobbies they enjoy. So that's really something that I've been doing it for 10 years now. I've been in practice for that long. And, and my practice is in Northern Jersey. And right now my office is in Wayne, and we're getting one soon in Paramus. So we'll be local. In terms of my background, I grew up actually outside of Boston. Ironically, my parents were both from New Jersey and ended up in Boston where I grew up, but then I came back. So here I am, and my family's here. My kids are in school here. So we've become New Jerseyans again. So it's been a really nice first third or so of my career, developing a practice here in Jersey. I got into orthopedics. I trained in Manhattan and also in the Bronx for my orthopedic residency and my fellowship, where I, subspecialized in upper extremity and hand surgery. So that's, a little bit about where I trained. And then in terms of why I do what I do, I just always really liked working with my hands. I liked intricate detail, which kind of gets into the hand surgical aspect of it. I do, microsurgical repairs at times, in the hand and fingers. So it really kind of, I guess, resonates with my interest, with fine detail. But I also have a hobby of, I'm sort of had a background in art, or at least an interest in art. And I feel like there's a lot of artistry that goes into recreating, anatomy, our anatomy, and really understanding it visually and really putting it back together as best as possible, because usually function will follow the form. And so I think that that's an important part of what I do, is sort of understand how to get people back to functioning properly. In order to do that, it's paying attention to the form of the bones and the joints and things like that. So that's me. So,
fascinating. You should say that, because usually I've heard that more in the context of aesthetic oriented surgery, like plastic surgery, for example. They'll often describe it as an art, or trying to, worry about what the individual will look like afterwards. And as for New Jersey, in my experience, it's a giant black hole. You try to leave, but it will suck you back in sooner or later. So currently I'm out of state, and I'm fearing the day that one day I will be forced to return at some point.
It'll probably happen.
Probably at some point. So that said, at what point when you're dealing with a patient, do you turn towards surgery, or do you maybe potentially push them towards, rehabilitation prior to surgery as an alternative, or like how does that process go when you're evaluating someone, I suppose?
Yeah, sometimes, not often, but sometimes I get patients that say, I give them options, and then they say, "Well, you're the doctor," and then I tell them, I said, "Look, I am the doctor, and that's why I'm giving you your options. If I didn't think you had a good option, I wouldn't give you options, and I would tell you this is what you should do." Um, and when I say that, I mean, for instance, things like atraumatic rotator cuff tears. Okay, so as we age, especially as we get into our 40s and into our 50s, a lot of people develop shoulder pain, and oftentimes that is you're in the spectrum of some type of rotator cuff tendon problem, whether it is a little tendonitis all the way towards having a full thickness rotator cuff tear. And there was no injury, there was nothing like that. And generally speaking, you can oftentimes solve those problems with therapy. Now, once you get to a point where it's either a full high-grade partial thickness tear or a full thickness tear, you can still try therapy as a first option. You can operate on patients who have full thickness tears, and you have to understand the natural course. And so a lot of my time in the office, I spend educating people about the problem, about what the natural history is. And I know this just through review of literature and a lot of studies that have come out over the years that show that once you have a full thickness rotator cuff tear, it's more likely than not to progress to either a retracted tear or something over time. However, if you don't have any pain, we can watch it. So if your pain can be managed with a course of therapy for 6 to 12 weeks, that's something that I encourage people to do. But I also have them keep in mind that surgery is also something they may end up needing at some point, and it's not the end of the world, but it is going to require a little bit more downtime and some more recovery, but albeit with a good a good result in the end. So I try to and maybe that becomes a little more long-winded for some patients who just want to hear here's what you need. But I ultimately, I do spend a little extra time, a lot of extra time at times with patients in order to make sure they understand as much as they possibly can about their problem so they can make the decisions. And I usually have to sit back and wait sometimes a minute or so for them to really kind of think through and ask questions and then choose the right approach. Because ultimately it's my job to give them the proper options and for them to choose the option that's best for them and their life. And a lot of times it's simply a matter of, well, I don't have time right now. My job is, it's really busy at my work. I'd like to wait for 6 months and those sort of things. And that's totally appropriate. Now, if there was something that absolutely needed an operation, then I have to break the news to them that they absolutely have to have an operation now. But that's generally not the case for most things I'm seeing in the office.
Don't you find a lot of the times that patients believe that the surgical intervention is going to be the all-on and cure-all? And I'm sure you preface the fact that say, look, you're going to have to put work into this. There's going to be a recruit, especially with shoulders. You and I both know that, especially once you tear something, the amount of contraction and adhesion that goes into the area is usually it's a pretty disciplined period of time. It may take anywhere from 3 to 6 months, based upon the severity of the injury and the other overall health and comorbidity stature of the patient too. So people sometimes lose track of that. They don't want to come in. They don't want to commit to therapy and chiropractic care, for a 3 to 6 month period of time to try maybe get them to more recuperative status. They want to jump right into surgery. And I say, you are possibly a surgical candidate. You're in review by the orthopedist. We both believe at this point in time that you should follow a course of conservative care and then consider the option at that point in time. What's your opinion about that? Don't you find that people think you have the magic wand sometimes to come in and fix it, and then it's like, that didn't work out the way I anticipated, or it's like, we didn't tell me. Yeah, you were up front. I did tell you.
Yes, 100%. And I think that unfortunately, I will say this. So as to the issue of, I think we're in a time and an era where we have a lot of options in life that are essentially quick fixes, or certainly band-aids that feel like quick fixes. When it comes to your musculoskeletal health, and this, in particular, like anything with tendons and anything that certainly post-operatively as well, but also you know for the most part, there's very few things that I do where, there's a quick fix. There are a few things, be it trigger fingers or things that I can inject with cortisone, or it'll go away in a few days. But generally speaking, if you've got a tendon problem, particularly with shoulder stuff, it does take a commitment. And it's interesting. There was an article a few years ago that it's not just doing the therapy, but it's also believing in the therapy. And there's an interesting article that basically showed that patients, they all had, basically partial thickness tears of their rotator cuff. And they looked at, how effective therapy was for these patients. They all kind of were in a similar category of pain, painful, symptomatic, partial thickness rotator cuff tears, or minimally, non-retracted full thickness tears. And the question was, who would get better with therapy? And they all started therapy, but before they started the therapy, they took a survey, and they, which essentially asked them whether or not they believed therapy would work. And interestingly, the most significant factor with respect to whether the therapy worked wasn't their age, their sex, the style of tear they had. What the most predictive feature was of whether they would get better was whether or not they believed therapy would work. And this is like, an orthopedic journal that is really just very, tends to be very mechanical when it comes to looking at these things. But it was a very interesting article because it really just showed that, how interconnected our minds are to pain and what we do when we go through these therapy programs. It is inextricably linked to how much we believe that it's working. It does have an effect, and it's hard to, as sort of a concrete surgeon, looking to plug this back into that and letting it heal. It's interesting to look at that and to reconcile that with how we go about treating it. So I usually encourage people, and I try to give them encouragement that therapy is going to work, so that they truly believe it, so they have the best chance for therapy to work.
Yeah, a lot of the patients that we've had earmarked for surgical conditions, sometimes they've done so well in therapy that obviously the surgery was postponed or not done at all. Then there are cases that the patient has a full thickness retracted tear. Their life doesn't fit into it for a variety of reasons. So we rehabilitate them up to the point of the surgical intervention. And then they have the surgery, and then we find that their recuperative rate is significantly improved because they did things before to get their body to a better state of health and function. And especially if we implement, like in my practice, more of the holistic parameter that say, you know what, you're a 55-year-old, overweight, diabetic, hypertensive, alcohol consuming overtly, cigarette smoker. You need to start looking at some things that you're doing in your life if you really want your body to heal appropriately. Your doctor will tell you right off the top, if you're smoking cigarettes, you cut down oxygen. If you don't cut down on oxygen, you're not going to get the waste out and the good nutrients and oxygenation into your body. So it's a critical factor. And we kind of work them through that. The other thing is also, and this is almost like an oxymoron for the time period, is the rapport that you develop with your patients. And it's not mind over matter, but the trust and belief that they have with you, whether you're an orthopedic surgeon, a chiropractic physician, a physical therapist, an osteopath, whoever it might be, I think is a critical factor in building that rapport. But yet here we are in the 21st century of medicine, and it seems that things are going in the opposite direction, especially now with the incidence maybe of telemedicine. It's like bing, bang, boom, 15 minutes maybe on the phone. Let's find out what's wrong. Take this medication. Let's move you on. Maybe you'll do some therapy, but can you even get in to do the therapy because of COVID and all the other stuff? So it's a very interesting time we're living in, wouldn't you say?
Yeah, I was just talking about this last night with someone about, not related to therapy, but it relates directly with this. What you just said is that, I think we can end around a lot of what we do on a day-to-day basis, no matter what you do for work. oftentimes you can, get through or even do your job, theoretically the same way on a computer or on Zoom, but there's something about, being around people and interacting with them in the workplace,
Most definitely.
showing up in person, that gives you a gratification for whatever that activity may be. It could be just as mundane as like an office job in a cube, but being around your coworkers, being in person. And that's, I think, what we talked about. We see a lot of that with like kids in school. Like, what's the value of kids in school? They need the socialization. Well, the same thing goes for people that go to work every day. So we're missing out on that. And that's directly translates into then when, you're when you have a musculoskeletal problem, then it's even, I think, more important, or just as important, I should say, to be in person, to be listening to someone, giving you advice moment to moment, moving you through ranges of motion, doing different modalities, different things that help you feel better, so that you believe you're getting better because you are, and your tissues are feeling better. But you can only give so many home exercise programs before people either don't do them, or they do them and they don't feel that encouragement, because there's such a psychological component to how we perceive pain and how we rehab ourselves and believe that we're getting better. We are losing that aspect. And I think that that's also that connection, that doctor-patient connection that the corporatization of medicine has sort of essentially is trying to get rid of. And we're realizing the heart of medicine is really getting carved right out of our office visits when we go see doctors these days. So it really weaves through every aspect of our lives, but in particular what we do, trying to heal people. Yeah.
I believe that's a huge component. I think as that becomes more and more stressed, it's going to be an unfortunate critical factor in the healing process too, where it almost seems like we're becoming less active and more robotic and more of the things. And if society allows itself to go into that particular direction, it's going to be definitely to the detriment of overall. And as you brought up the thing before, like my wife is a clinical social worker, the interaction of children one-on-one as opposed to doing it telemedicine is a huge factor, especially when the children have certain challenges, autism, Down syndrome, various genetic disorders too. Extrapolate that even with an adult, and it's like almost like a failure to thrive. It's like, look, we could all get an education from reading a book, right? We could all do calisthenics and work out on our own, but there's something about working out in a group or something like that, like I just did in CrossFit. There's something, we got Netflix now, we've got all these movies that we can watch, but what was it like going into that beautiful Art Deco type theater and just being surrounded by that whole ambiance? You know what I'm saying? That's the connection that people have. We're not machines, and that's what we have to be. And quite frankly, it's an interesting correlation. As a surgeon, as a chiropractor, as a physical therapist, we're the hands-on of our professions, if you think about it. Right? They have Da Vinci robotic machines, but nobody probably can do the job that you could do, at least to the level that you do. Thus far, they haven't created other than the certain instrumentation to replace what I do, and to a certain degree with physical therapy. So I think that interactive component is a huge part of the healing process. And, the more that we can work together on an integrative basis, I think that is an incredible factor. It's like, when you and Jen came down and sit with me too, and you said, look, and I have to tell you, it's very interesting. I owned a multi-specialty practice for about 13 years with a partner who was an internist, and we had a physiatrist on staff and everything else. And, the worlds did not meld as well as they do today. Look, we have an interaction between chiropractor, orthopedic surgeon, neurologist, radiologist. The ultimate thing is to get the patient better. That's the whole thing right now. And no one has one specific answer. It really takes a group sometimes to really get that patient to a therapeutic end. And okay, so maybe you guys aren't doing that much in the world of nutrition or some of the other things, PEMF and things of that nature. I can do that. You don't do manipulation. I can do that. But I don't do surgery. You can do that. The therapist can rehab. You know what I'm saying? We all have a job. And if we all interact and work with each other, it'll be a much better outcome for the patients, and they heal better and they do better. And that's really, what we're trying to put together through things like this podcast and what have you. We've had different doctors of different discipline with that mentality. And that's one of the things I was happy about in meeting you, that, it's nice that you kind of get that.
Yeah. I mean, when I first started in practice, it only made sense to me that, it's not that you pick, I pick chiropractor to treat all my problems, or I pick orthopedic surgeon to treat all my problems. It
Right.
doesn't make any sense to me that you would do that. And I think that it comes up against some of the issues related to business, and some of the, related to patients, and feeling like it just, when everyone can trust one another and can understand how you can work in a complementary way, patients win.
Yeah.
And you win as the doctor. I think it's just that not a lot of doctors, and maybe for good reasons at times, but not a lot of doctors tend to have a lot of trust in other doctors that aren't part of their own ship. And I feel like, I have a small practice. It's very personalized. I would, call it, fashion it like a boutique, essentially, where we have me, myself, Dr. David Ratliff, and Dr. Lorian Stern, and we're experts in what we do, and we rely on a community of other specialists and other disciplines to help us get our patients the best care. And that's the one thing that I can say. Like, people say, well, why would you go here when you could just go to the system and has every doctor known to man? The problem is that those are employed doctors, and that's a whole nother topic. But the reality is, as much as, and there's some great doctors that are employed and have to be employed, unfortunately, in the way that the healthcare is structured these days. But there's a difference. When you're an employee, you just don't have that same dedication to your patients. You just don't. Your boss is the system, not the patient. In my practice, my patients are my boss. I do nothing without the patient. I don't get a salary from anywhere. I only make I only make ends meet and pay my staff based on the patients that come in and do well. And it inextricably links their results and their satisfaction with my success, as a doctor. So once you start to layer things in between that, that's just how humans work. It's just less important to be, to put 110% in. You can put 90%. And it starts to be felt downstream, because there are some doctors that don't even put 90% in. And so, and it's taxing, because you were burdened with so much paperwork. It's just, at some point you break down as a human. You can only give so much. So that's the one thing I will say as a private practice doctor, that I've been able to maintain that autonomy that allows me to, be a good partner in the community with other doctors that do other things that we can then send patients to for the best care. And that's really what I'm hoping I can maintain as time goes on.
Yeah. Unfortunately, there are challenges against that right now, as you see the world of corporate medicine expanding, the hospitals buying up practices. I mean, I've had many friends, especially within the orthopedic field, where they've had an incredible level of autonomy and independence for a long period of time. And what was presented to them and what ultimately came to be were two different things. And some of them left with some significant financial issues, because you're not going to be able to fight a hospital. You know what I mean? They have teams of lawyers. Here you have to go out and now say, well, this is not what you said, and blah, blah, blah. Well, you could take us to court and, we'll drag this out for the next 3 years. By then you'll be bankrupt. So you could settle for this, and this is the way it goes on. It almost seems like the arbitrage issue of business has now come into medicine, because the economic rewards associated, especially in the pharmaceutical industry. So, but you know what? I believe, honestly, that if we continue to do the things that we need to do to help our patients, that we'll be able to continue to, not only survive, but prosper. Because I tell, some of our patients are now more so than, in a surgical situation. A lot of our patients have to pay out of pocket. But I always say that money is only the issue in the absence of value. And if people have enough value, they may wind up going to get that therapeutic treatment or surgical procedure, whatever is necessary, as opposed to, buying that TV set or a new car based upon what the cost factors are. So, we just have to keep going. And it gets very hard for the individual practitioners sometimes. They feel a little beat up, wouldn't you say?
I would say very much so. I think we're all
Yeah.
feeling it, whether we are
Yeah.
employed or in private practice. We're getting, crushed essentially
Yeah.
on our end. But really, where patients feel it is premiums, right? Premiums, no matter how little
Right.
they pay us, premiums never go down, and that's the
No.
big question mark. Where
And
does the
they go up more and more all the time, and they cover less and less, and it's just crazy. It really is.
There's the analogy, and there's so many hands in the cookie jar, and our hands are as the people actually doing the work and providing the care tend to be the weakest and smallest hands in that cookie jar.
It's
Uh,
crazy. Yeah.
the ones who are focused on the money all day long are the ones that tend to find ways of keeping it and find and giving it, making sure that we don't get as much as we probably deserve, which makes us more prone to be leveraged out into an employed model or get out of,
Yep. Yeah.
lose our businesses. And it's terrible to see doctors who I know have known for years, who are great doctors who have dedicated their lives, probably took years off their lives with what they sacrificed going through all the training they did and all the practice and late nights they did,
Mhm.
but then find that they can't even make ends meet. It doesn't
Yeah.
make sense with all the money that's in healthcare. So, that's one of the reasons why, back 3 years ago, I started the Doctor Patient Alliance as an advocacy organization, because there really were, even the advocacy organizations that we had, between, all of our societies and what have you, they weren't, they seemed like they weren't advocating for certainly the independent doctor, but just doctors in general, because we're the weakest voice now when it comes to what we do, because what we do ultimately relates to patients. And when you advocate for doctors, you're advocating for patients, and that's really what we end up doing, is we advocate for patients, and we're inextricably linked when it comes
Yeah.
to value in healthcare and what patients get out of it. Because
Yeah.
when the doctors don't get paid, guess what happens? Um, I'm not talking about extravagant payments. I'm talking about just literally keeping the lights on.
Yeah.
Um, and that's what's happening. There's a
Yeah.
reason why your doctor just went out of business and joined the hospital. Everyone has had that experience where the doctor, oh, that doctor's now working at this hospital. That's
Hmm.
because the doctor had to, because they could not pay their staff. They could not pay their overhead. It's just a business like anything else.
Sure.
Um, I think patients don't, and they shouldn't necessarily have to understand that, but ultimately they're the last ones to know when they don't have access anymore to the best doctors and the ones that knew them and knew their family. And we're all feeling it because we feel like the healthcare system's depersonalized,
Yeah.
and it is. So we've been advocating for, it's interesting when you do advocacy, you realize that it's overwhelming, because every day and every week and every month there's a new regulation or law that comes out, and it's kind of like trying to you're swatting flies, and it's like you turn around, there's three more, and it's a really exhausting process. And you realize how many resources really are required to advocate for patients in this
Yeah.
system. um,
That's been a trend in many industries. My background is in finance, and essentially the cost of compliance has put out of business most of the smaller firms, forcing them to either merge with larger firms or go out of business. And then to your other point, I guess for I guess consumer parallel, you're basically experiencing the Walmart effect, crushing the mom and pop shop, and then leaving the person with, well, Walmart, at the end of the day.
Right. Or Amazon at this case. And the interesting thing is that Walmart actually employs twice the number of people that Amazon does. 750,000 Amazon, 1.5 million with Walmart. I never knew that before, just reading through the literature. But this has become, remember, for years they tried to deregulate the telephone companies and then, the monopolistic activity. We're basically moving towards that, if we haven't already really accomplished that within the field of healthcare. Nobody can really practice by themselves anymore. It becomes ever more challenging. You've got to either sublet space or bring other people in, because it's just too costly to just do your own thing. The average practitioner comes out of school in debt for at least $250,000, and they haven't even opened an office yet. And the bottom line is that now they have to be able to either finance it and get started, and then the equipment comes on board. It's becoming ever more challenging across the board.
Yeah, It's really next to impossible. There's very few out there that can just start up afresh. Like you said, you starting out $250,000 in debt at least.
Yeah.
Most people are much higher than that. They're probably
Sure.
$500,000 in debt.
Yeah.
You're not ready to start incurring more debt and starting to build up your own practice. You're basically going to join a hospital system or a big group, and then that gets a restricted covenant issue where, even if you spend your time building a practice and actually have a following, you don't have the options of staying in the area you built a reputation of following. And then you have to go and start over, or so you become. I made this analogy a while back, but I think it's apropos to what we're dealing with now. Is like doctors have become the new sports free agents. You're basically jumping around from contract to contract around the country. I see a lot of doctors who they get employed. They're great doctors, but they get employed. They go through a 3-year contract. Like you said, it's not what they expected usually, especially ones that are growing and outgrow their contract and really perform beyond it.
Mm-hmm.
And then they don't get offered what they probably deserve. And I'm generalizing, but these are stories that I've heard over.
Sure.
And a lot of them have to then leave, and they go to a different hospital system in a different part of the state or a different part of the country. And that's like, it's become, essentially like a military family or a baseball free agent. You're just jumping from contract to contract every 3 or 4 years. And, who would have thought I never had that thought in my mind as a doctor, that would be the way, the environment I would be in. And I've been very fortunate not to have to do that, but it's taken a lot of time and energy on my behalf, and on my family's behalf to go through a process of trying to stick it out in one place.
And we haven't even discussed or touched the tip of the aspect of defensive medicine because of the issues associated with litigation and malpractice fees and things of that nature, and overt diagnostic procedures, 3/4 diagnostic, 1/4 treatment. And the patient's just saying, I just want to get better. I don't want to be bounced around from person to person, things of that nature. But, that's the other factor that's happened in the world of medicine, that connection sometimes that we go back to once again. The GP and the internist maybe have more of that going on. Practitioners like yourself that have more of a rapport within the realm of orthopedic care, you could possibly develop too. I certainly have it as a chiropractor because I'm more family based, and then, more of the holistic aspect of things, but it's become ever more challenging. So, this is an interesting world we live in. Who thought we were going to, when people get on right now, they think, oh, maybe they're going to learn something about a shoulder or a back or something like that. And here we are. We're just talking about the reality of what we deal with every day, because we're people, regardless of whether you call yourself a doctor or not. You have to live in this world and function. And what we're trying to do is bring a better quality of life to the people that we serve. So.
Yeah, and I think even a level deeper on the patient level is how we live our lives. And there's so many distractions. There's so many quick. It's almost like we have we started out many decades ago with candy, and that's really not that healthy for you. We have candy in the form of social media, things that really mess with our our brains, our children's brains. I'm not saying these things in the right doses are probably fine, but the reality is it's like, a lot of this stuff is designed to essentially be addictive and really kind of mess people up mentally. And we see this mental health throughout our society, between all that we're, that's put out there. It's affecting the way people feel about themselves, their mental health, which ultimately gets into why they are having back pain or why they're having. So all the things that I'm treating and you're treating are downstream effects of what our society essentially is creating a lot of times.
Yeah.
And so a lot of the real solutions is how do you eat better? How do you have a healthier lifestyle? How do you decrease stress? I certainly am someone who's currently trying to figure out how I get I have less stress in my life. I put it off for a long time, and it's something that I'm working on actively now, but it's in everyone's lives. And
you got to work at it. It's not like, drop your body off at 9, pick it up at 5 o'clock, like most patients think they'd like to do. You have to actively participate. And one of the things that I gravitated to more, establishing more of a holistic base. But I mean, look, there are mechanical problems. We correct the mechanical lesion things. But as I said, you got to look at their lifestyle, their diet, their stress levels. I treat people on that equilateral triangle, as we talked about: structure and function, biochemistry and toxicity, and emotional well-being. And when one goes out of balance, it affects everything. So you may have a herniated disc, but if you're stressed out of your gourd, you're going to make it worse. If you feel pretty good, you know what I'm saying? There's a component of all those different things. If you're eating a diet with a lot of refined carbohydrates and sugars and things of that nature, you're going to create more of an inflammatory process in your body. So, you know, garbage in, garbage out is computer language. You basically have to get the person to a better state of health and function. And you and I had talked about even the day that you came in with Jen, if you remember. So, yeah, look,
Yeah, sleep is a big issue that I've been dealing with. I became an expert at, you know, I'd get tired, you know, maybe like around 8:39, and then I would power through, you know, being tired, and I'd get out another 2 or 3 hours of, you know, either doing nothing important or doing something important, but nevertheless, I wasn't sleeping, and you know, I've had issues where that's added up over time,
yeah,
and
sure.
your immune
Exhaustion,
system.
bodily exhaustion. Yeah. And then you can wind up with those things that all of a sudden your eyeballs pop open, and then you can't fall back to sleep because all the things that you didn't want to think about just seem to come and visit you at that point in time. So
That's it.
this is part and parcel of the whole thing. How are we doing on time, Craig?
We are at the 1 minute and 40-second mark.
So, Doc, we'd love to have you come back again too. Why don't you give us some information how people can get in touch with you?
Yeah, thank you. Like I said, my office is in Wayne. Right now, we'll be in Paramus in the next month or so, probably. But our phone number is 973-898-5999. And yeah, come if you have any issues, orthopedic, upper extremity, musculoskeletal issues, please give us a call. I'd love to see you and evaluate you and help you out.
Our website?
Yeah, www.modernorthonj.com.
Awesome. You know, like Dr. Taffuri said, so many topics that we could talk about at length and unpack. You know, very interesting stuff. Would love to have you back at some point. I mean, so many things to consider, but we're coming up at the 1 minute mark right now, so I think this is a good stopping point.
Sure, I'd love to. Thank you very much. I'd love to come back at some point. This is a
Great.
Very good. Dr. DeNoble, thank you so much for participating today with us. And this will hopefully help some people, you know, to see a better and clearer outlook when looking for a practitioner that they can seek help with. So
great.
Yeah, thank you guys.
Well, thank you,
All
and
right.
have a good one.
Take care.
Be well.